Senator Rubio.
Thank you. Ms. Duncan, one of the overlooked downsides of this regulation is the effect that it's having on nonprofits. In Florida, I've had a number of important communities of we have an important community of nonprofits, and I've had a number of them, care providers for children and adults with developmental disorders. They're telling us they'd be forced to relocate current patients and would have to reduce the number of the disabled that they take in their doors. This rule is most disruptive for the patients that depend on these services. So in your testimony, you state that the flexibility of your employees is key to your ability to help the population you serve. In the nonprofit sector, rigid corporate schedules don't always apply to people who choose to work for your organization out of their desire to help people, not just for a salary. How key is pay flexibility to the kinds of people that you employ, and therefore what impact will this have?
For pay flexibility or hour flexibility?
Both. I mean, but hours especially.
Yeah. So we're a global organization in over 60 countries around the world, and many of our employees are working with individuals at these foundations, and so the ability to have a conference call with China, who's 12 hours ahead of us, is key to be responsive to the needs they have at the time, instead of waiting by the time we've come into work 12 hours later. And while we could still consider that time and pay overtime, it certainly provides quite a burden to constantly having to figure out how we do that, how we clock in, how we count those hours. So I think that flexibility, I think that most of our employees are professionals. I'd say over 90% have college degrees and are on professional tracks. Really even the motivation or the desire to be in that more professional position, I think it would be very demotivating if they had to turn around and now all of a sudden be considered either non-exempt, or the impact of us meeting the salary requirements. As I stated, we have come a long way. I think traditionally there was an idea that, hey, we're doing great work, so you should feel good at the end of the day and we can pay you nothing. We've come a long way since then, and many nonprofits are very competitive salary-wise. And the responsibility that our folks have is huge. And they need the flexibility to get that work done without asking permission.
But just based on what you've said, the implementation of this rule is currently anticipated would be deeply disruptive to work schedules and the ability to provide services. At least that's been the testimony we've gotten from multiple nonprofits throughout Florida, and I imagine from your testimony, I gather you're saying that would be as well.
Yes, because we'd have to, from a financial standpoint, look at how we cover the cost of any increases if we increase salaries, and so that's fewer surgeries because our fiscal year budget is already done, and unless a donor comes up and says, okay, here, I'm going to fund your changes, which is most likely not going to happen in the next month. So we'd have to reduce the number of surgeries that we're providing, or we would have to look at, alternatively from offering the jobs in country, coming up with a way to hire in-country candidates, which wouldn't be the level of, we like the training and the corporate environment of having people here at our headquarters to